such an incredibly stressful process that women go through during ovarian stimulation, not just the emotional and physical elements, like most women are uncomfortable, but also just the disruption to daily life, like having an appointment every day, getting a call from a nurse. And so to have exercise to provide psychological and physical benefits is really important.
Welcome to the Egg Whisperer Show. I'm so pleased to have special guests Rachel Katzman and Dr. Shannon DeVore on today's show to talk about your personal evolution of fitness and fertility.
Thank you so much for having us here.
So you guys are launching something amazing called Moving During Fertility Treatment Series through P.Volve. Rachel Katzman is the co-founder of P.Volve, a multi-million-dollar femme-centric fitness brand that merges physical therapy, women's health, and functional movement. She started the company in 2017 when her own body was diagnosed with scoliosis, making her realize that she needed a change in her workout routine. And Dr. Shannon DeVore is a reproductive endocrinology and infertility specialist at NYU Langone Fertility Center. She joined the P.Volve Clinical Advisory Board in 2022, where she helps to create fertility-focused content using evidence-based practices, as well as improve the woman's fertility journey through functional movement. Welcome, you guys. Thank you again for joining us for this extremely informative discussion, because I get so many patients that ask me the questions that you guys are going to help answer today. Where does the name P.Volve come from?
It stands for personal evolution. And it just at the whole beginning of this, of me really thinking that women's fitness needs to evolve, but it's so personal. And what you really as a woman need at each stage of your life is so different, and it's different from woman to woman, person to person.
Will you share a bit about your vision in starting P.Volve?
Yeah, I mean, my vision has changed so much since starting P.Volve back in 2017. I was early 20s and I just wasn't feeling connected with myself. I didn't like what I saw in the mirror, and I really started on my health journey, and I couldn't find a workout that was really speaking to me. I wasn't seeing the physical results that I was after. And more importantly, my body was in more pain than before I started working out. I found out I had scoliosis. And like most people around this time, it was really this pain equals gain. You have to be hunched over and dripping sweat when you walk out of a class. I was just going to push through that pain and keep going. And I really got introduced to this world of functional movement, and I had no idea what that meant. I was used to boxing or Pilates and all these types of modalities, but I really started to understand that through functional movement, you really are working with your body's biomechanics, and you're really training your body in the natural patterns that it moves in day-to-day life. And really that combined with resistance equipment really started giving me these amazing physical results that I was after, but it helped my back pain. My hips felt more open. My ankle felt more open. Just all these things that weren't really at the top of my mind prior to this. My whole life changed really from the inside out. And I just had this light bulb moment of there needs to be an evolution when it comes to fitness, specifically women's fitness. And this really, I thought, was the answer. And as I set out to build this company and really started working with different trainers that had different certifications and different backgrounds, yes, I wanted to give me a great butt and great arms and great abs, but it should be doing so much more for me. It should be enhancing my life. It should be improving my balance, stability, creating strength in my body, and really activating my major muscle groups, but supporting all the ones around them for these incredible life-changing results. You know, we set out to launch P.Volve back in 2017, and it's been an amazing journey ever since.
And for people who are listening who don't know the difference between functional movement and a regular workout, what are the differences?
The way that we apply functional movement to our method and to our classes is really utilizing these different movement patterns. I explain to people, imagine if you're moving in 3D, like I'm moving my hands right now. If you're really going to take up all this different space, and you're going to be working your body in external rotations and internal rotations and a lot of physical therapy inspired moves. So maybe a lot of stretches and opening up the back, but you're really making sure that your body is moving in all different planes of motion that it's meant to move in, versus some classes you're stuck maybe in one position, or you're just moving front to back instead of opening and closing side to side. So I really think our magic sauce is really that, combining it with our resistance pieces of equipment.
And has your business changed at all in the last few years?
Just as I've personally evolved and as we've grown and we've heard from our members, it really was these after benefits of P.Volve that our members were experiencing. Everything from, when I jump on the trampoline, I'm not peeing anymore. I can pick up my kid and I don't have lower back pain. And all of these, just maybe they didn't come to P.Volve for that specific reason, but they're staying at P.Volve for that reason. As we started to hear more of these stories, and I experienced different things throughout these past couple of years, getting diagnosed with Lyme disease and all these different things, I really wanted to create this advisory board, this clinical advisory board with strong female doctors like Dr. DeVore and other incredible women to really work with our trainers and create this very specialized content. So yes, if you're doing any one of our strength and sculpt classes, you can be working on strengthening your lower back and your pelvic floor, but we really wanted to create these specific videos and classes that were for these very certain need states that a woman goes through at every stage of her life, everything from your period to menopause to fertility, which we're going to get into, to pelvic floor strengthening and so on. So I think it's our offerings and our content have really just expanded to make sure that we are supporting a woman no matter what stage of her life that she's going through.
And I'm really curious about the pelvic floor and how that plays a role in fitness.
People don't realize, and I definitely didn't realize this, I had to get educated, but that the pelvic floor is actually a muscle and it's part of your core. So when you think of your core muscles, your back, your abs, your pelvic floor, they really need to work in balance to make sure that you're giving yourself that stability and strength that your body needs. So like any muscle, it can be strengthened and it can be released. If you can either have really a weak pelvic floor or even too tight of a pelvic floor. So if you have pelvic floor dysfunction, that can lead to things such as pelvic pain, painful sex, incontinence, and so on. I'm really happy that this topic is coming to the forefront. Back when we were creating content and talking about this, it was a little taboo and nobody really wanted to be discussing your pelvic floor, but we have programs on how to strengthen and how to release. And you'll hear in a lot of our videos, our trainers just cueing on your breath and how to really activate and turn on those muscles. And I think as you strengthen and you really become more aware and more in tune, your core strength, it really becomes to a whole new level, and your balance and your stability, you can see start to really increase.
And you guys recently launched a program called Moving During Fertility Treatment. It's a series. What does that include and how does that work?
That's something I worked on in conjunction with Dr. Colby Hancock at Spring Fertility. And so during ovarian stimulation, we tell patients not to exercise. The ovaries can increase in size 3 to 4-fold and are at risk of twisting on their blood supply, something called ovarian torsion. Ovarian torsion is a surgical emergency and in some cases can lead to loss of an ovary. So it's honestly easier as a physician just to say, don't exercise at all the entire cycle from when you start your injections to when you get your period the following, like 28 days later, approximately. But that's not true. Like you can exercise safely during this stimulation, but you could say avoid high impact exercise, but that's not true either because yoga contains risky movements like downward dog and inversions, which can make the ovary prone to twisting. So we worked together with the functional movement experts at P.Volve to design a series that is synced with your cycle. So like the early follicular is different than the late follicular. So as you're starting the injections, your ovaries really haven't started to enlarge yet. And you don't need the same restrictions that you do at the end of the cycle. And then also, so working toward each time in the cycle and then keeping the pelvis stationary. So it's a really great program that you can speak with your doctor about. There are certain patients that I still would not advise to do this, like somebody who's had a previous torsion or is at risk for hyperstimulation or has kind of a cyst of some kind that we're worried about. But most women can safely do this program and it's incredible. There's a lot of feedback involved in mindful meditation and really focusing on the core and what you're working towards.
Awesome. Thank you for creating that, because I now know where I'm going to be setting my patients when they have questions about exercise. I usually just say, well, use your common sense. It's fine to exercise. Just stop when you feel like it's time to stop, because trust your body, right? But now that's really great that there's a physician approved program and you've worked with Rachel's trainers to create. I mean, that just feels really good for patients to feel like they have a trusted resource to go to. So that's amazing. I'm really excited about this. And I want to hear more about like exercise and the benefits when it comes to fertility. Can you just address maybe like PCOS and exercise, endometriosis and exercise, and just in general, trying to conceive and exercise and what the fertility benefits may be?
We've done the most research on PCOS and exercise, and diet and exercise for PCOS should be first line treatment for this state because patients are at risk of insulin resistance and metabolic syndrome. And so even just decreasing weight and improving strength by a small amount can lead to hormonal regulation and resumption of menses in some women. So at least as an adjunct to treatment. So there's a lot of data to, suggest that's very beneficial. Endometriosis is a little bit different. So that's more inflammatory and can cause significant pain. Exercise is generally, it releases endorphins, which help fight inflammation. It improves blood flow to tissues, which brings the nutrients there, mobilizes the lymphatic system, which removes toxins away. So certainly is a beneficial adjunct to treatment for endometriosis as well. In women who are trying to conceive, there is some evidence that shows moderate exercise improves outcomes. And interestingly, there's a lot of data that shows high impact, intense exercise can negatively impact outcomes. So there is like the right kind of exercise, which I think P.Volve kind of hits on the mark.
That's great. And I'm sure you are a fertility mythbuster every day, just like me. And there's so many myths about exercising and pregnancy. And that's the goal. We want our patients to get pregnant. And then they ask us about exercise too. So what are some things that you tell your patients, and what are some of the things that they've heard about exercising in pregnancy that you want to myth bust today?
Yeah, so exercise is really beneficial in pregnancy. Of course, starting a new program where you're doing movements that are outside of your repertoire and possibly not safe, I wouldn't recommend. But otherwise, starting a program that gradually builds up and plays on what your continued level of fitness is really important. I don't think that there's like a heart rate number that is safe or not. It's all relative. There is some core work that probably needs to be adjusted throughout the pregnancy, but P.Volve does a really nice job of outlining, giving you kind of a step-by-step throughout the pregnancy. And everybody's been trained in women's health and all of that. So it's a nice way to go, but no, I mean, you can absolutely safely exercise in pregnancy.
That's awesome. Now, when my patients graduate from my practice, I give them a bunch of links, my favorite pregnancy app, my favorite pregnancy books, and now they're going to get the P.Volve links so that they can now exercise in pregnancy and know that the movements, again, have been physician endorsed.
I do want to just say, I think that especially with fertility, this series, I'm so excited to launch it. I actually am about to go through the egg freezing process with Dr. DeVore. In about like a month, we're going to start. And for me, just personally, exercise has always been my answer, no matter what I'm going through, really just more of a for my mental health. And it was so important, like, especially during this time, to tell someone like me not to work out. Like, mentally, that was not possible for me. So I'm so excited for this program. And I think that making sure that we do have these very specific need state piece of content so that somebody can feel supported. And it's going to be different no matter what you're going through in life. When I had Lyme disease, I wasn't doing the type of workouts when I was really in a bad flare up that I was doing prior. It was more restorative and gentle, and just having something that you can go to and that's right for your body on that day can do so much for your mental health.
I agree. And you guys have created a series for women during their whole lifespan, basically trying to conceive during pregnancy and then menopause. So talk to me about what you guys are doing to support women during menopause.
Yeah, we really found that 84% of women felt their menopause related symptoms interfered with their day-to-day life, and that they really weren't equipped both with the knowledge or tools to help mitigate this. So we worked with experts and our amazing trainers to develop a program that really combats symptoms for women in this transitional time period. So we really try to tackle, loss of muscle mass. So that's using heavier weights into our programming, which is so important in order to increase muscle mass and help boost metabolism, bone density, heart health, which we use our low impact cardio that doesn't really making sure that we don't deplete the body. Pelvic floor health, which we talked about earlier, and really the importance of your pelvic floor. And it's very crucial for this population. They can experience sexual discomfort and a more uncontrollable bladder. And this program really emphasizes on pelvic floor health to help mitigate this. And then lastly, mindset, mood, and recovery. During this time period, there's a lot of psychological factors at play, oftentimes really increasing your cortisol levels. So we really try to use restorative stretches and recovery videos and meditations that really can help, this and the lack of sleep that women experience during this time. And we've seen like a really great response from this program. And it's really nice to be able to have everything from what to do when you're going through getting your period, fertility, pre-postnatal, and now to be able to offer menopause to really kind of round out that holistic story.
Yeah, I'm beyond impressed. Beyond impressed. So where can people find P.Volve and how can they get started if they're interested?
So you can find us at pvolve.com, P.Volve on all social channels. You can sign up for a free trial. You don't need any equipment if you want to just go in and start playing and looking around. And you can find everything on our website.
Okay, awesome. Thank you for sharing that.
Thanks so much for having us.